Welcome to Insider Medicine in Depth. I'm Dr. Susan Sharma. Older patients without significant risk factors for complications can go home the same day they undergo a percutaneous coronary intervention without increasing their risk of dying or needing to be hospitalized again, according to research published in the Journal of the American Medical Association. Here's some information about PCI. It refers to a collection of minimally invasive procedures designed to unclog the blood vessels that feed the heart. It includes balloon angioplasty with or without stent placement. It is one of the most common cardiac procedures performed on older adults. Researchers from the Duke Clinical Research Institute evaluated the outcomes of more than 100,000 U.S. Medicare patients aged 65 or older who underwent PCI at one of more than 900 centers between 2004 and 2008. The patients were divided into two groups based on whether they were discharged the same day as the procedure or they stayed overnight in hospital. Just over 1% of the patients were discharged the same day, while the remaining nearly 99% stayed at least one night in hospital. Despite this practice, there was actually no difference in the risk of dying or being hospitalized during the first 2 days or the first 30 days following the PCI procedure for those who went home on the first day. There were no major differences between the two groups of patients before the procedure took place, but patients who were discharged home the same day generally underwent a shorter and less complex procedure and were more likely to be evaluated as being low risk for complications. Even among those patients who did have adverse outcomes, an overnight stay in hospital did not make a difference in rates of death or rehospitalization. We had a chance to speak with Dr. Sunil, the principal investigator of the study, who offered some further insight.
While this is an important procedure that is being done on your heart, you can rest easy in the fact that current techniques and current medications that are used for the procedure have resulted in an incredibly safe procedure that has a very, very low risk of complications, such that hospitals that have actually a protocol in place for sending home patients the same day can do so without an increased risk of having to come back to the hospital or dying within 30 days.
Today's research suggests that while most physicians are reluctant to do it, patients who undergo PCI and who are at low risk for complications can safely be sent home on the same day as the procedure took place. For Insider Medicine in Depth, I'm Dr. Susan Sharma.